ली सदरी व यस्सिरली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। अल्लाहुम्मा इन्नी अस्अलुका इल्मन नाफ़िअन रिज़्क़न तय्यिबन व अमलन मुतक़ब्बला शिफ़ा मिन कुल्ली दा। Today I am going to discuss the malignant vaginal lesions, that is the part 2 of the vaginal pathology. Vaginal carcinoma incidence. 1 to 2% of all the gynecological cancers. When we classify, it is number 1 primary, squamous common 85%, that is adenocarcinoma, 17 to 21 years of age, metastasis to lymph nodes, clear cell adenocarcinoma. Number 2 secondary, metastasis from the cervix, endometrium and others. 50% in the upper third, 30% in the lower third, and 19% in middle third. Posterior vaginal lesions more common than the interior, and the interior are more common than the lateral lesions. So the lesions, as we see, that the posterior lesions, they are common than the interior, and interior are more common than the lateral lesions. Spread is by the direct and lymphatic. There is direct spread and by lymphatics. So when we classify, it is the primary lesion, which includes the squamous 85% adenocarcinoma, and when the age is 17 to 21 years of age, metastasis to lymph nodes and clear cell adenocarcinoma. Then secondary, which come from the metastasis come from the cervix, endometrium and others, and spread is by the direct and lymphatic spread. Vaginal carcinoma. When you do the staging, clinical staging, FIGO classification is FIGO classify staging. Stage 1, tumor confined to vagina. Stage 2, tumor invades the paravaginal tissue but not to pelvic side walls. So, number 3, that is stage 3, tumor extends to the pelvic side walls. And stage 4, it includes A and B. Tumor invades mucosa of the bladder or rectum and or beyond the true pelvis. And number B, distant metastasis, as I always say, liver, lung, bone, brain, LLBB, we should remember. So clinical staging includes 4 stages, always as others. In the case of when stage 1, it is usually confined to the vagina, and 2, which spreads to the paravaginal tissue, stage 3 to the pelvic side walls, and stage 4, it is the metastasis. Treatment. Stage 1, tumor less than 0.5 centimeter, which is deep. Surgery, what we do, we have 2 options. Number 1 is the surgery, local excision or total vaginectomy with reconstruction surgery, and B part, radiotherapy. First we do the surgery and then we give the radiotherapy to the patient. In 2, that is stage 1A, now stage 1-2. Tumor more than 0.5 centimeter deep. A part, wide vaginectomy, pelvic lymphadenectomy and reconstruction of the vagina. Part B, we do radiotherapy, like in the case of stage 1A. Radiotherapy is the part B. Stage 2, part A, radical vaginectomy, lymphadenectomy, and part 2 is the radiotherapy. Again, radiotherapy is the part 2. Stage 3, we do radiotherapy. With that, thank you. I hope it will increase your knowledge.